Another area of the body that patients often ask about is their thighs. Whether it be they feel that there's a little bit too much bulk, a little bit too much fat in certain areas, or some patients also have a little bit of extra skin, or they find their skin is a little bit loose. If it's simply fat and they just want to have a narrower, a slimmer silhouette of the thigh, liposuction is an option, which is a minimally invasive procedure with small, short little scars used to introduce a cannula that sucks out the unwanted fat to give a nicer, slimmer silhouette. That's not for everybody. If the skin is already a little bit loose, the patients have to be aware if we remove too much fat, it can actually make the skin a little bit looser. So good skin quality and realistic goals is important before getting into a liposuction procedure of the thighs. If there is extra skin, it depends on the areas of the extra skin where it's present, what type of procedure we do. If there's extra skin on the thigh, a thigh lift is the recommended procedure, which is a major surgical intervention where we remove and excise the unwanted skin. If it's simply unwanted skin in the inner upper thigh area, which is the most common area, we can often do the thigh lift and place the incision or scar on the upper inner parts of the thigh. So it's hidden by most underwear in the groin area. If, however, they have extra skin on the whole length of the thigh and they want a general tightening of the whole thigh, then we have to continue this excision and scar all the way down the inside of the leg. This is a more dramatic procedure that gives a full tightening of the thigh, but the patient has to be aware and realize that they will have a scar that will be visible in shorts because it goes down the inside of the leg. Again, this is always case by case and patient by patient, and depending on their anatomy, where they do have extra loose skin, and also their goals. If they don't mind having a little bit of extra loose skin and they don't want to have a scar, that's also an option to do a less invasive procedure. Again, case by case and patient by patient.